Hello everyone, this is Dr. Vuong. I'm the Director of Bariatrics at Loveless Bariatrics in Albuquerque. This is my discharge instructional video for my patients. So if you're not one of my patients and you're watching this video, please follow the instructions given by your own surgeon and your own program, okay? This video is intended for my patients. This is what I teach my patients, all right? So to my patients, congratulations. If you're watching this video, then you probably just had weight loss surgery with me. So what I want to do is give you your tips that you need to follow in order to be successful here in the immediate post-operative period, okay? Tip number one, your primary purpose this week is to stay hydrated. That's it. It's not to clean out your shoe closet. It's not to go shopping. It's not to make your husband dinner. It's to stay hydrated. That's your number one goal. So all day long, you need to sip on water or ice chips or an OptiFast. So just a little cup, just take small sips continually throughout the day. That's your number one goal. Stay hydrated. Now, how do you know you're hydrated enough? The easy answer to that is as long as you're peeing, you're okay. If you're making urine, you're doing okay. Okay? So now, what about your urine? You're looking for something slightly yellow, okay? If it's slightly yellow, you're well hydrated. You think Bud Light, Coors Light. If your husband's cheap, then it's Keystone, Milwaukee's Beast, all right? So, but as long as you're making urine, you're doing fine. If it's getting a little darker, like an amber Bock or Shiner Bock, you're not drinking enough. So take a few more sips in. If it's black like Guinness, you're dead, so don't call me, all right? You waited too long. No, I'm kidding. Just keep sipping, you're going to be fine. Your primary goal is to stay hydrated, okay? Number two, you want to try to get in 3 OptiFast if possible. Now, write this down. You might have a day where you can't take in 3 OptiFast. You might have a day where you can only take in 2 or 1. It doesn't matter. Your primary goal is not to drink OptiFast. It is to stay hydrated, okay? So, if OptiFast is getting too thick, like it's taking you all day to just get 1 down, what do you have to do? You got to back down to water. Remember, water and ice chips is thinner than your OptiFast shakes or soups, okay? Now, if water is getting too tight, what do? You need to call me, all right? Just call me. Don't Facebook me. Call me. I need the record on of the call, and I'll talk you off your ledge. Most likely, you're going to be just fine. Okay, as long as you're making urine, you'll be just fine. Now, if you're only taking 3 OptiFast a day, each OptiFast has 160 calories. That means you're consuming only 480 calories. So, what's your energy level going to be like this week? That's right, it's going to be low. You're going to be really tired. So expect to be tired. All right, so repeat after me. I just had major surgery. You know, I know you're looking down at your scars and you have like a couple little tiny scars and that's it. But remember, this was a major surgery and it's a big impact to your body. So you need to rest. When you're not resting, you need to be walking, taking deep breaths, using your incentive spirometer, and staying hydrated. All right, so you're gonna feel tired because you're not consuming many calories. All right, now be prepared to feel the worst around 3 to 5 days after surgery. So if your surgery was on Monday, your tightest day, worst day will probably be Saturday or Sunday. All right, because why? Because your baby sleeve might swell up so that it's no bigger than the tip of this pen. That's really small. So the inside of your baby sleeve is going to be prime real estate. You only want to put the most nutritious things in here that's possible. So that for right now is water and OptiFast. All right, so be prepared to feel tired. Now if you're sipping on OptiFast, it's too tight, you back down to water, you'll be fine. Stay hydrated. Now if OptiFast is going fine, but you feel like you need a few more calories, then what you can do is make fresh juices. Why fresh juices? Because you're after the nutrients. Okay, you're after the fresh nutrients. So you need a juicer, not a blender. This is a juicer. You can go buy one, make some fresh juice. It's awesome. Or you can go to one of the juice stands, juice bars, but make sure you ask for a juice, not a smoothie. Smoothies and mushy, that's the next phase we'll talk about. So just get through this week of liquids and you'll be fine. Now, you're going to start mushies next week. Now, everyone should have a food calendar. If you don't, please call my office if you've lost your food calendar. Go by your food calendar. It will tell you when to increase your textures. So next week, usually for most patients, it'll be either Wednesday or Thursday, you'll start your mushy phase. Now, when you start mushies, remember you just want to dip a spoon into it, lick the back of the spoon, and then sit and wait, because that thickness might be enough to fill you up. All right. Now, if that mushy is too thick, you got to back down to optifast water again. Okay. Now, what's the problem with mushies? High in calories, low in nutrients. So here are 2 healthy mushies for you. One is a fresh pureed soup. So take any vegetable you like. Let's say you like broccoli. Boil it, dump the whole thing into a blender, add some seasoning, whatever you like. Add some broth. You can use your optifast chicken soup as a base, for example. Blend that up. Now you have a fresh pureed soup. Add tofu to it if you like, and it's great, full of nutrients. So that's one healthy mushy, is a fresh pureed soup. Try different recipes. Butternut squash and apples, fantastic, right? Second type of healthy mushy is a green smoothie. So hopefully by now you have a NutriBullet or Nutri-Ninja, a Vitamix if you want to spend $400 on a blender, but you want to make a fresh smoothie. I use a handful of spinach, a small banana, frozen blueberries, and any other frozen fruits you want. Some water, some honey. Play with the recipe, but that's your basic recipe. Don't forget to add the green spinach or kale or arugula and get that freshness in there. Okay, blend that up and you have a shake that's full of nutrients. Okay, remember, this part of your surgery, you're trying to give your baby nutrients to heal. You want to heal that staple line. It's very important. Okay, it's true you can have mashed potatoes. But what's the problem with that? Not much nutrition in mashed potatoes. It's true that you can have yogurt, but remember, not much nutrition in yogurts. Okay, now if that mushy is too thick, really thin it down. In fact, I would tell you, when you first start mushies, make it real thin. All right, and remember, if your baby's not ready for mushies, you just got to back down, back to optifast and water. Okay. Now remember, do not go faster than our food calendar that we give you. Our food calendar is already very aggressive, all right? But here's the key. You might have to go slower than the food calendar, depending on how your baby's responding to the different textures. So if the food calendar says fish texture, but you take one bite of fish and it's real tight, guess what? You're not ready for fish. You've got to go back to mushies, all right? But don't go faster than the food calendar. All right. Next question that's very common: your medicines. Dr. Vuong, what do I take for medicine? So here's the key: take only your essential medicines. Well, first we'll talk about your non-essentials. So your non-essential medicines: do not take any vitamins. Do not take any supplements. Remember, your sleeve is going to be as skinny as this pen. So don't put any vitamins or supplements in here. It's not very important right now. Don't take your fish oils. Don't take any of that stuff right now. Don't take any of your allergy pills. You're not going to die of allergies. I know sometimes you feel like you might die of seasonal allergies, but you won't. Don't take your restless leg syndrome, your kicking your leg medicine. You probably shouldn't need your sleeping pills because you just had major surgery. You're only consuming a few calories. You should be tired. You should be able to sleep, all right? So don't take any of your non-essentials. So what are your essential medicines? Your diabetes medicines. You want to definitely take your diabetes medicines, but the key to that is you got to check your blood sugars, right? Because what have your blood sugars been doing since you've been in the hospital? They've probably been really, really good. So if your blood sugars are 100, you probably don't need to take your metformin. Besides, metformin's a big pill. So here's the rule when it comes to pills. If you have a small pill that's about the size of a battery watch battery, and you're taking Optifast, okay, you could probably swallow that pill whole. So here's the rule. It's one pill at a time, 30 minutes apart. So one pill at a time, 30 minutes apart. Don't take a handful of pills anymore. Just one pill at a time, 30 minutes apart. Now, if your baby's really tight and you're having trouble keeping down Optifast, and it's a pretty big pill, you better crush that pill. Now, if you don't know whether it's crushable or not, you need to call your pharmacist. Don't call me. I don't know about your pills. Call your pharmacist. Ask if it's crushable. Ask if you can open it. And also ask them if there's a liquid formulation. All right. So that's the deal with pills. Essential pill. Another one would be a high blood pressure pill, and your thyroid pills. Those would be essentials. Now, when it comes to your antidepressants, that's a big controversial one. Now, if I'm ever called before the judge because you went crazy and started slapping your husband around, I'm going to tell the judge, Your Honor, I swore I told her to take her antidepressants. But the truth of the matter is, you've probably been off your antidepressants for several days now since you've been in the hospital. And you have to decide, do I really need this antidepressant? Right? Why am I taking this antidepressant in the first place? Okay? These are tough questions you got to ask yourself. Now, if you're on the couch and you're crying and you won't get off the couch and you stay in bed all day, then you need to take your antidepressant. All right? But pay attention and see what your moods are like. All right. So when you leave the hospital today, you're going to go home with 3 new scripts. One is Protonics. That's an antacid. Now, you have to take this antacid every single day for 90 days. Why? Because your sleeve is going to hyperproduce acid, all right? And you need to take it to suppress it. Now, if your insurance won't pay for Protonics for whatever reason, don't panic. What I need you to do is go buy Pepcid over the counter. You can buy it the generic form. It's a small tablet. Take it twice a day, and let us get your insurance to approve the Protonics. It's usually having to fill out a script, but don't go without an antacid. All right, that's really important. So take your Protonics every day for 90 days. Script number 2 is the Lortab Elixir. That's your pain medicine. You need to take the pain medicine, especially at nighttime, to help you sleep, because you'll be tossing and turning. You know, your husband's going to punch you in your belly to make up for all the times you're mean to him. I'm just kidding. But take your pain medicine, all right? And take it first thing in the morning also, because you want to start off your day. You're going to be moving around more. You're going to feel it. Now, if it's making you too groggy, you can just take regular liquid Tylenol or children's Tylenol. Make sure it's in the liquid form, all right? The third medicine you're going to take is the Zofran. That's the nausea medicine. It's an oral dissolving tablet. It will go underneath your tongue. And you put it one underneath your tongue, let it melt, and it'll help with your nausea. But remember, nausea is also a sign that maybe your baby's trying to talk to you. Maybe you drank too fast. Maybe your baby's not ready for mushies. You have to ask yourself, why am I nauseated? Okay, so always listen to the baby. Which takes me to the next thing, constipation. Do not get constipated. Now, with all of this liquid Optifast, these pain medicines, the surgery, there's a tendency to become constipated. And you want to try to fight that. You do that by sipping on a lot of water. That's one. Number 2, if you get constipated, you need to get a suppository, a Dulcolax suppository. You get that over the counter, all right? And make sure you get a bowel movement. If you don't have a bowel movement, you need to repeat it. All right, if you still don't have a bowel movement from below, you need to give yourself an enema. Now, once you have a bowel movement, then you can follow that up with a Miralax or milk of magnesia orally. All right, and if you still can't go, then you're going to get yourself a little bottle of magnesium citrate, and that'll make you go. All right, but the number one cause of belly pain after surgery is actually constipation. All right, your baby's fine, it's probably constipation. So don't get constipated. All right, so that's the key with your medicines. Next topic, do not weigh yourself. So you guys have gained 15, 20 pounds of IV fluid, water weight. All right, so don't weigh yourself this week. It'll drive you crazy. In fact, when you come to group next week, we won't even weigh you. All right, we'll wait 2 weeks. It's all fluid shifts. Trust me, you'll drive yourself crazy, so stay off the scale. Next number, this one's really important for all the support people. You've got to be in group next week. Why? Because I'm looking for complications. There's no reason that's good enough for you to miss group. I need to see you in group, so find a way to get there, okay? Next number, you've got to listen to your baby, all right? This is really important when you're at home. Now, whose baby is it? It's your baby, all right? It's not your husband's baby, it's not your mama's baby, it's your baby. So you have to always pay attention with the baby. Remember when you first brought home your infant child? Like, you love that baby. You always paid attention to it. You never dropped it down and forgot about it. I did that with my newborn, so don't take my advice. But normally, you're going to pay a lot of attention to that baby, okay? So when you're sipping on water, if you feel pressure, that's baby talking to you. If you're hiccuping or you're burping, That's baby talking to you. So you have to say, what's wrong, baby? Did I drink that water too fast? Is baby not ready for mushies? All right? So always pay attention to your baby. And as long as you do that, the baby will be good. Okay? So just go really slowly this week. Don't expect too much from yourself. You just had major surgery. All right? Come to group next week because I got to see you. Okay? Come to group. So, next thing you got to do. All right? I want you to laugh more. Why laugh? Laughter boosts your immune system 20%. That's science. Immune system means healing your baby, and we all want to heal our babies. All right? So you need to watch like old Seinfeld reruns, Friends episodes, Archie Bunker. All right? You got to laugh more. All right? Don't watch Twilight, that depressing stuff. Don't watch Schindler's List. Don't watch Sophie's Choice. Watch good, funny stuff. The Jeffersons moving on up to the top. Okay, you want to watch the stuff and make yourself laugh. All right, which takes me to the next number. Your surgeon means it when he says it. Think only positive thoughts. You need to think only positive thoughts. Every day gets better. Every day gets better. If you think that, what's your recovery gonna be like? That's right. It's gonna be easy. Now, almost everybody has a tough day. And I call it the WTF day. You're going to get home and you're going to say, what the fudge did I just do? Don't panic. It's very common, okay? I call it postpartum depression. We worked so hard to have this baby. Now you've had the baby and you get home, you're like, now what do I do? Okay, don't panic. Just think positive thoughts. Think, I'm going to get better. Everything's going to get better, okay? Which leads me to the corollary. That means you got to keep out negative thoughts. All right, you got to keep out negative thoughts. And where's most negativity come from in America? That's right, television. So you got to stop watching television. Don't watch any television this week, especially the news. There's nothing good on the news. See, you cannot change the economy. You cannot stop Donald Trump from running for president. You cannot help Albuquerque police find that missing girl. But I know every time you watch a news article that upsets you, where do you feel it? In your gut. Now you got to think about that. Now you're having, a new baby there, and you got to take care of it, okay? So keep out negativity. Don't watch the news anymore. And negativity comes in many disguises. It comes as ex-boyfriends, best friends, co-workers, church members that say, Mary, I knew you had surgery, so I brought you a pecan pie, your favorite. Like, no. You're just not ready for guests. So keep out some of these negativities. All right? So this takes me to the final tip, and this one's really important. All right? This is the time you need to do all the things that I teach you in group. You need to meditate. You need to set your goals. You need to journal. You got to ask yourself these tougher questions. What's Christmas going to look like this year? What are we going to do on vacation? What is the next 2 years going to look like? Am I going back to school? Am I quitting my job? You've got to plan these things, right? Meditation is a very powerful tool. And don't wait for me to lead a class. You should YouTube it. It's all stuff you can learn. What are some healthy recipes? These are things you can Google. Journaling, as I said. This is the time to spend on these self-development things. Because reality is, you're not going to be doing much other than just walking and resting and sipping on water and Optifast. So this is the time to focus on you. Don't rush back to work. Don't jump back into the fray. Take this time for yourself. Okay? And if you follow these simple tips, I know you do great. Okay? I'll see you in group next week. Thank you all very much.